Hello everybody. So here's the answer to the Dermpath quiz on the 20th of February. So I just presented histological images here. The first image is just an overview giving you, showing you what the silhouette is like. So what you're seeing here is relatively normal epidermis, slight hyperkeratosis here, normal epidermis otherwise. If it is a non-face area, if it is a face, then you could say there is hyperkeratosis and acanthosis. But this is actually a lesion from the hand, and therefore this sort of epidermal thickness and hyperkeratosis is normal for this particular area. But you can make out it is not the face because there are not many follicular sebaceous units, so you can clearly make out, and there is a relatively thin dermis. If it is a biopsy of a trunk, the dermis would be quite thick. This is a relatively thin dermis, so you can make out this is a sort of a limb, probably a distal limb, because proximal limb again shares histopathological features with the trunk, i.e. thick dermis. So a lot of eccrine glands here, you can see them. And there is not much going on in the papillary dermis, but in the mid dermis you're seeing this infiltrate, sort of foci of infiltrates here, which do appear granulomatous even on low power. You can make out the granulomatous nature of the infiltrate even on low power. Now for the higher power images I will discuss on here. So you can make out here on higher power. What you're seeing here is a relatively busy dermis, as we would call it. Here the collagen fibers have taken a different hue. You can make out the collagen fibers are much more pinkish here. Can you make it out? This is more basophilic change. This basophilic change is essentially suggestive of collagen degeneration. Okay. So degenerated collagen changes its color, it appears a bit more blue, and that is why this is labeled under a blue granuloma. And this is a classical example of blue granuloma, i.e. this is a case of Granuloma annulare. You're seeing the nice necrobiosis, degeneration of collagen. These are degenerated collagen bundles, and once it's completely degenerated, you see this sort of homogeneous, more fibrous sort of degenerated appearance. The collagen bundles no longer retain their normal appearance, i.e. strips of this sort of eosinophilic straining structures. They appear quite basophilic, and you no longer see the boundaries of the collagen bundle. Alright. Now number 2 is a lymphocyte here, this small blue cell. Lot of lymphocytes are on the blood vessels. And number 3 I told you is basically necrobiosis. Number 4 is a giant cell here. Often you see this along with degenerated collagen bundles. You see a few giant cells here and there. And number 5 is degenerated collagen bundle, which I was pointing out. Number 6 is an endothelial cell. You can see there's a small blood vessel, and the endothelial cell is lining that. Now I told you previously, endothelial cells and histiocytes may look similar. The easy way to differentiate them is that endothelial cells line blood vessels, while histiocytes are sort of out with the vessel wall. Okay. Now going to sort of the other image, you see the higher part of the same thing. Now 7 again is a nice giant cell, easy to make out. 8 is a degenerated collagen bundle. You can make out sort of a small lymphocyte attached to the collagen bundle, trying to eat it up, as you can see, and there is a clear space around it, probably due to edema around the degenerated collagen bundle. Now this sort of bluish stuff here is also suggestive of mucin. Often Granuloma annulare is associated with mucin deposition in the dermis, and if you do an iodine blue stain, you may pick it up, and you can see this sort of bluish hue in between the cells here and the interstitium here as well. Now number 9 is very tricky. This is actually a blood vessel wall which you're seeing in cross section. You're not seeing the vessel lumen, but you can make out it's a blood vessel wall. It's not a nerve fiber. Please go back to the pictures of nerve fibers I've shown you in previous case of Hansen's. Nerve fibers have much more, the nerve cells are much more thinner. They're not this epithelioid cells. Now these are epithelioid cells which are sort of going away in an angle. If you can imagine this, here you're seeing this is the same blood vessel, sorry, a different blood vessel, but a similar silhouette. You're seeing here the blood vessel wall in cross section, sorry, in sort of transverse section rather. But here you're able to see the lumen, and therefore this is not difficult to identify as a blood vessel. Here it's slightly more difficult because you're not seeing the lumen, you're just seeing the wall which has been cut sort of perpendicularly. And these are all endothelial cells here. Okay, so this is a slightly tricky question, number 9, but yeah, the rest of the cells you can make out these degenerated collagen bundles, a giant cell here, lots of histiocytes around the degenerated collagen bundles, a lot of lymphocytes here as well along the blood vessels. So the final question was that's the clinical picture of the histology. This is a case of Hansen's. You may think maybe vitiligo even. Again, the histology doesn't match. This is showing a lot of purpura in the legs, a case of leukocytoclastic vasculitis. This is showing a bit of eczema on the eyelids. Again, this is not the histological picture, but here you're seeing a nice annular marginated lesion, typical of Granuloma annulare, and this is where this histology belongs to. All right. I hope you enjoyed this quiz. Thank you very much.